We also have Moksud with us. Moksud, good evening. Moksud will take care of the. Good evening, Moksud.
Good evening, sir.
Welcome to the telecast and a big welcome to our respected resource persons. Shomit Chaudhary sir is joining us. We also have Nilotpal Bhattacharjee joining us all the way from New Delhi. So, welcome to day two. We are supposed to be joined by an eminent resource person today. She is Dr. Vijayashree Patil. She is an anesthesiologist by profession and also critical care specialist. She's also a hospital administrator, and she runs her own hospital. So we will get to know a lot about the situation in Mumbai and the different protocols that are used in ICUs for COVID care. And we'll also ask her about how this pandemic has really challenged the existing healthcare system. So it will be an interesting session. But the problem is it's been raining incessantly in Mumbai as well, and there have been network issues. So we hope that we can get Dr. Vijayashree in. I'd just like to talk to you a little bit about some good news that is coming in. Biocon has announced the launch of the monoclonal antibody for moderate to severe patients with acute respiratory distress syndrome. So I'd like to begin this session today by just talking a little bit about the pathogenesis of coronavirus, how it causes its symptoms, and what are the different treatment strategies that are being adopted in different settings. So as you are aware that coronavirus is an RNA virus, and it enters mostly by the respiratory route, although in some cases fecal transmission has been reported. So the cardinal symptoms of coronavirus infection are fever, number one. Then you will have cough. This cough is productive cough, that is cough with sputum, and then breathlessness. So let us try and understand why you have all these symptoms. And to understand that, you'll have to understand the pathogenesis of the virus. So once the virus, you must have seen the images of the virus. The name actually has been derived from the Latin for sun. So corona, it just after a total eclipse, the image is like that of radiating spikes. So this virus has spikes all around its capsule, and it is the spike proteins which are the most threatening. And once it enters the lungs, it goes and affects the alveoli. So alveoli are the units, the smallest units of gaseous exchange, where oxygen and carbon dioxide are exchanged in the lungs. And in the alveoli, it basically causes two things. One is that there is accumulation of fluid inside the alveoli, which we call alveolar edema, and the second is alveolar collapse. So in both the cases, what happens is it becomes difficult for the person to breathe. So this is what is known as ARDS, or acute respiratory distress syndrome, and this happens because of the alveolar edema. Because of the alveolar collapse, what happens is the oxygen tension in the body comes down, and because of the reduced oxygen in the body, what happens, the sympathetic nervous system gets overactive, and there is increase in heart rate and blood pressure. As this continues, what happens is it puts more pressure on the heart, and that is when it also puts pressure on the kidneys, and that is when towards the end you have multi-organ failure. So that is in brief the pathogenesis. Different molecules are being tried. Hydroxychloroquine is being tried. The problem with all these therapies is actually that uh, because it is a novel coronavirus, because we don't know much about the behavior pattern of this virus, we have adopted different strategies. So the first strategy is by using dexamethasone, or which is a steroid. So the role of steroid is to reduce the inflammation. So to reduce the alveolar edema and the alveolar collapse, dexamethasone has been found to be effective. Also hydroxychloroquine, which prevents the entry of the virus into the uh, alveolus, that is also being tried, and some other agents are also being tried, and we'll learn more about them from Dr. Patil when she joins us. The important thing about COVID-19 to remember is that the triad of symptoms include fever, and this fever is because of an inflammatory response. In fact, what happens is that there is a cytokine storm. So this is an immune response. So the body tries to fight off the virus, and in the process, what happens is there is release of a lot of cytokines or harmful chemicals. These harmful chemicals go and damage the host itself and not the virus. So that inflammatory process gives rise to fever. We have already discussed why cough happens because of the disturbance in the alveoli. You can have cough. You can have cough with sputum and also pneumonia, which is an important risk factor. Also, breathlessness because of alveolar edema and alveolar collapse. So, I hope this will be a good introduction to the symptoms of coronavirus, as we are expecting some good news because the monoclonal antibody has now come out. You must have also read on Sunday about the Russians who have claimed that they have come up with a vaccine. But the problem is that it will take a lot of time to get marketed, because it's also interesting to discuss how a vaccine actually gets marketed. So there are different phases, and for a vaccine
I think Himobrata has got some technical glitch. We couldn't hear him for the last 1.5 minutes. So Maksud, are you in?
Yes, ma'am. So it's
Yeah.
okay, ma'am.
Okay. Okay. Okay.
So can
I'm
you hear?
sorry, I had to leave the meeting.
Okay.
How much could you hear, madam? Could you hear anything or nothing?
Yeah. No. 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 We just started with this monoclonal antibody, and then
Yeah,
it has. It,
yeah, so I'll just finish before Deviprita madam and Moksut can take over. So these monoclonal antibodies are our hope in moderate to severe cases of acute respiratory distress syndrome. So welcome once again, Devprita Madam. Good to have you on the program. And I'd just like to ask you about what you felt about yesterday's start, and what do you think we should discuss today, and what should be the agenda for today? What do you think?
Okay, yesterday it was a very good session as we all were here, and our expert was very very nice person, and she tried to give reply to all the queries, but due to some technical glitch, she couldn't. Though she promised that she will be back today also. She wanted to come back, but then it seems in her place there is no electricity due to heavy shower and flood situation. So as earlier we have planned that we will learn some relaxation process from her. So I would request you, Himobrata, since you are also a clinical psychologist, why don't you teach us some relaxation method? But Sangeeta is
Okay,
not
madam.
here.
Thank you for the suggestion. Moksud, can you just tell us in brief a little bit about the agenda for this evening?
Yeah, actually, as ma'am said, uh, we'll be having a relaxation methodology what you will teach, and with the course of the due of the session, we will talk about how the user's mind is being manipulated by the today's COVID situation, how they are being like being fluctuated due to small things in their daily happenings of their life. They get fluctuated, and also they try to copy someone else's lifestyle, and try to bring it on their own and try to design their own lifestyle. So that hampers a lot. These yuvas are basically doing this. When others are going doing successful things, they try to copy others. So we
Yeah.
should focus on this also today. And
Okay. Okay.
if time permits, I will share a story, and I will give a head start to it. Thank you.
Great. 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 And নমস্কার ম্যাডাম অনামিকা দেব শুনরানি গো।
হ্যাঁ হ্যাঁ শোনা যাচ্ছে।
হ্যাঁ গতকালকে
আপনি
আপনারে
শুনলেন?
আমরা হ্যাঁ 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 আপনারে
হ্যাঁ
আমরা গতকালকে চেষ্টা করছিলাম, কিন্তু গতকালকে নেটওয়ার্কের সমস্যা থাকায় আমরা আপনার লগে কথা কইতে পারছি না। খুব ভালো লাগছে আপনি আপনার ছেলের লগে জয়েন করছেন। আহ
থ্যাংক ইউ।
হ্যালো জুনিয়র,
বলো। হ্যালো বলো। হ্যালো।
কিতা খবর তোমার? হাউ আর ইউ? গুড ইভিনিং।
গুড ইভিনিং। গুড ইভিনিং।
Thank you. Please stay with us. So it's great to have such a wonderful audience. Arunodoy, good evening.
Yeah, good evening, good evening.
And what I'll do today, Arunodoy, is we'll talk a little bit about meditation, because yesterday we could not get Sangeeta for a long period of time. So I am not an expert on meditation, I must confess, but I think we should discuss a few pitfalls that some of us experience while trying meditation. So you think should we go on and discuss a little bit about meditation, Arunodoy?
Yes, very much, because I
Okay
meditate
then.
every day.
Yeah, and in fact, we can learn a little bit from you about how meditation can help us. Bisho is here.
Good evening, sir.
Good evening, Bisho. Good evening. And are you okay with a little bit of discussion on meditation?
Absolutely, sir. I'm fine.
And
Okay with it.
all of us can share our thoughts on meditation. Chirantana, welcome.
Yes, sir. Thank you, sir.
Yeah. How is everything at Silchar Medical College?
My father has got little better now, so
Excellent. That is
things
very
are
good.
stable now. Yeah.
Yes. And we were discussing yesterday, right, Chirantana, that the approach will now become aggressive against the virus. So there will be a lot of steroids that are being used. We spoke
Yes,
about
sir.
plasma therapy also, and we are getting close to the vaccine. So we're getting some
Yes, sir.
promising results. Yeah, thank you so much for joining in. Shomit sir joins us. Good evening, sir. Good evening, sir. Welcome to the telecast. And sir is saying good evening. So thank you so much. Shotoporna, good evening and welcome to the telecast.
Good evening, sir.
And do you practice meditation, or how do you handle stress? Do you practice any relaxation techniques?
No, sir, I cannot. I fail to meditate. I don't know why. So
Okay,
I'm looking forward for
okay,
proper
yeah.
suggestion.
Yes. And even I have that kind of a problem. So we'll talk about how we can become good at meditation. It's good that Arunodoy does meditation a lot, so we can learn from him as well. And
Yes, sir.
I'll ask Shantani, good evening.
Good evening, sir.
Do you try meditation, or how do you handle stress mostly?
Sir, I did. I used to do meditation long before, but now I don't do because I lag behind this thing, and I procrastinate the thing a lot. Like as I already said yesterday, that for consecutive 3 days I can do, and the fourth day I really feel lazy to do meditation. So I personally don't do
Okay.
meditation and can't handle stress.
So, so what is happening is it's difficult really to demonstrate meditation from out here, but we can just talk about a little bit about the concept of meditation. Okay. Now, all of you must have heard about or read about this concept of mindfulness, right? And this is an important concept in it is an important concept in psychiatry, and it is one of the therapies that is also advocated a lot. So in mindfulness is actually a derivative of an ancient Buddhist tradition, okay? And in that we call it vipassana in Buddhism. So we will talk a little bit about mindfulness, and then there is the other form of meditation, which is about awareness. So in mindfulness, what actually happens is you focus on your breath mostly. So as you focus on your breath, madam, should we try it once, all of us together?
Yes, yes, yes. Why not? Why not? And
Let's
before we try it, Amrita, I just want to ask you, like, is there any fixed timing for practice meditation, or what is the like surrounding? What type of surrounding do you really need for practicing meditation? If you
Yeah,
can.
madam, before we talk about meditation, it is very important to understand that to become good at meditation, you have to lead a very disciplined life. You can't expect to enjoy meditation if you are involved in unholy or unfair acts all day, right? So you cannot think যে আজকের দিন আমি খারাপ চিন্তা করবো আর ঠাকুর ঘরে গিয়া বইলাম যখন তখন আমি সাধুরার মতো বালা চিন্তা করবো. So the actual difficulty in meditation is not the meditation proper, but what you do with your spare time all the day. Okay, so that is there. Regarding routine, some people like to do it in the morning, some people like to do it in the evening. It really depends on when you are comfortable and depends on your time zone. Some people say, should we do it in a holy place, in a specific corner of the room? I think that is open to the individual as to where he will go and sit for meditation. But the basic idea is that you have to be conscious of the thoughts that come to you, and you have to imagine yourself like a traffic police. So traffic police যেরকম থাকে রাঙ্গিরখাড়ি পয়েন্টে, এ কিন্তু ওইখানেই দাঁড়িয়ে থাকে, ঠিক না? নেই, ট্রাফিক পুলিশ তো জায়গার দাঁড়ায় দাঁড়ায় ট্রাফিকটা রেগুলেট করে। তো একটা গাড়ি ধরুন সোনাই রোড থেকে আইলো, একটা গাড়ি মেডিকেলের দিক থেকে আইলো, একটা গাড়ি গোপীনাথ পয়েন্ট থেকে আইলো। তো ট্রাফিক পুলিশের কাজটা হইলো গিয়া এক জায়গাতে দাঁড়াই থাকা, কিন্তু অবজার্ভ করা যে কোন জায়গার থেকে গাড়িটাই না। সো সিমিলারলি ইন মাইন্ডফুলনেস আওয়ার অবজেক্টিভ ইজ টু জাস্ট pause and focus on our breathing and try and so the idea is to try and observe the thoughts that happen. So let us try this for 2 minutes.
Yeah.
Let us just sit relaxed, not stiff, একদম বালা করিয়া বইন, সুন্দর করিয়া রিল্যাক্সড হইয়া বইবা, বইয়া আরামসে আমরা 10টা লম্বা শ্বাস নেই. Let us take 10 deep breaths, okay?
So a question has been asked by Chirantana. Will it work while sleeping to get sleep?
Not a very good idea. You actually want to be conscious when you are doing this, not in a drowsy state. So it will be better if you get some sleep prior and then do meditation, okay? Otherwise you might fall asleep, okay? So if it helps you falling asleep, that's a good thing. But the basic idea of meditation is to try and make sure that you are strong mentally, right? So let us try and
actually I could not get sleep yesterday. I slept at 3
okay
by taking
so you can also try
clonazepam.
Okay. So we will talk about your problems, but I just like to ask all of you to stay relaxed and not stiff for the next 2 minutes, and let us make no noise. Try and take a deep breath. As you take a deep breath, you focus on your nostrils. So you forget about the rest of your body and just focus on your nostrils. As you take your breath in, you can feel that your tummy is expanding, right? শ্বাসটা নিলে দেখা যায় পেটটা বড় হইতেছে। শ্বাসটা নেওয়া শেষ হইলো, মনে মনে উই কাউন্ট 1। আস্তে আস্তে আমরা শ্বাসটা ছাড়ি। শ্বাসটা যেই ছাড়া হইলো, আমার ফোকাসটা থাকবো হইলো গিয়া অন দ্য নস্ট্রিল, মানে আমার শ্বাস প্রশ্বাসের উপরে আমি ফোকাস করব। সো লেট আস ডু দ্যাট। আস্তে আস্তে হোয়াট উইল হ্যাপেন ইজ, একটু পরে ইউ উইল সি দ্যাট সাম থটস কিপ কামিং। So the idea is not to engage in those thoughts, not to follow those thoughts, but to try and observe those thoughts. Okay, so let us do it for the next let's say 2-3 minutes. Okay, and I'll ask you how you felt. Just take a deep breath. You can feel the oxygen entering your lungs. You can feel your tummy expanding. And now very gently release, exhale. Let us do it again. And try and the idea is, let's say if you feel like coughing or if you have an itch, the idea is not to stop yourself. Okay, the idea is to just experience what is happening around you. Just try and observe yourself, observe your breathing. Now you can close your eyes. Just close your eyes and take a deep breath and experience your tummy expanding. And now gradually release the breath. Exhale and focus on your nostril. Just feel the oxygen going into every body part. Keep your eyes closed and gently exhale. So as you do this, a lot of thoughts are coming to your mind. Some are happy thoughts, some are sad thoughts. Different thoughts have different emotional quotient. But the idea is to just observe these thoughts as they come. Just like in a Facebook live, when you press heart, the hearts just keep booming up on your screen. Just let the thoughts come and go. And focus on your breathing. Let's do 3 more breaths. 1, as I say 1, I will focus on my nostril and take a deep breath. I can feel my tummy is expanding. And now gradually I breathe out. Let us do it once again. Take a deep breath. You can feel your lungs filling up. Your tummy is expanding. And now you can gradually exhale and focus on your breath. Let us do it one last time. On the count of 1, take a deep breath. Experience your tummy expanding. Your lungs are getting filled with oxygen. You can feel the gaseous exchange that is taking place at the alveoli. And now is the time for you to bring out all the carbon dioxide. Exhale and open your eyes. So, Arunodoy, that is one of the techniques that we adopt, right?
Yeah. Because
And,
breathing is a very good anchor to remain in the present.
Absolutely. So that's a very good point that Arunodaya makes. Breathing reminds you that you are in the present, right? So we tend to focus a lot on what is happening in the past, and this is actually a way to try and realize that we have to live in the present and we focus on our existence. And this prana in our Indian thinking or our consciousness is something that is unique at the same time universal, right? Vishwa,
We have a question. We have a question from Chirantana. She is asking, is it like more or less like Sudarshan Kriya?
uh, I will not answer that question directly because we are not trying to promote any belief system or any spiritual thought here. So I would rather try and avoid that question from Chirantana. But what I
Okay,
have
sir.
just
Sorry.
mentioned what I have just mentioned is a very secular form of meditation, okay? Because there are, like I mentioned yesterday also, meditation has uh, been influenced by different civilizations and different cultures. So I will not specify whether this technique that I demonstrated is similar to some other technique. It is actually up to you as an individual to choose the kind of meditation with whatever works for you is okay by me. So I will not try and answer that directly, but if you think of some holy person or if you think of some holy image or symbol during your meditation, you are absolutely free to do that, okay? But the basic idea is to try and focus on your breath and try and remain anchored to the present, like Ornoda very beautifully said. Bisho, I'll come to you. Could you follow the exercise?
Yes, sir. I did.
And how did you feel?
So I felt very good. It was relaxing.
And what kind of did you experience any thoughts coming into your mind?
No, sir. I was listening to your voice, so I think that's why maybe.
Yeah. So that is also a reason. And also, you can't expect this to work. This is only a very small demonstration, right? So
Yes, sir.
if you do this for 15-20 minutes, what will happen is then you get an insight into yourself also as an individual. Okay.
Sure, sure.
So
Sir, I had a
uh,
question, sir.
please.
Sir, earlier, like 6 months back from now, I used to meditate. I tried for 1 week, and then whenever I tried, I tend to get sleep. So how to overcome that, sir? I tried in the morning after waking up. Still, I
Yeah,
like
it is
kind of.
difficult to. We human beings are very good at imitation, right, Bishro? So
Yes, sir.
we really love it if people also do what we do. In fact, we have something called mirror neurons in our brain, and those mirror neurons react. They are responsible for empathy. They are responsible for judging the response of someone. That is why it's very funny. Now, when you see somebody smiling, you also feel like smiling, right? When you see somebody
Yeah.
crying, you feel like crying yourself. And this is because of the reciprocal mirror neurons that we have in the brain. In fact, in the frontal lobe, we have those mirror neurons. So, one good suggestion would be to do meditation in a group, maybe. In a group, if you do, what will happen is you will get motivated by all the other group members. The
True, true.
reason why people find meditation difficult is because they think of meditation as an escape, but meditation will not be an escape from reality, right? Meditation is only, like Arunodoy said, meditation only reinforces that you have to remain anchored to the present and you have to uh, experience the thoughts and the emotions that come inside you. So in a way, meditation is a lot about knowing yourself and trying to find out the real meaning of yourself, which might be different for different people. So I think it's a gradual process. So if you start again, Bisho, and with the right mindset, I think and if you try it gradually, let's say 10 minutes for the first few days, then go up to 15 minutes, then maybe half an hour. That will be a good way of resuming that good habit. Okay, we've
Yes,
also
I will
got
try.
Shotaporna. Shotaporna, could you follow the instructions?
Thank you, sir.
Yes, sir.
And did you have trouble? Did you have problems?
Yes, sir. While you were asking to concentrate on the nostril, I was not able. I was, in fact, concentrating on my eyes, which were shivering. So it was difficult for me to concentrate on the nostril part.
Okay, okay. So, in fact, it is not easy for all of us. All of us have difficulties in our initial trials with meditation, because what happens is it is like the example that Madam Thakur Ramkrishna used to give is that of a Kalir Duat, right? Of an ink pot. And
Yeah.
what happens to an ink pot is when you try to wash an ink pot, what happens? First, the water that comes out is very dark, right? তো কালির
Yes, sir.
দুয়াত্রে যদি দইতে যাও তাইলে কি হইব, প্রথমে দেখবা কালা রঙের একটা জিনিস বাইর হয়। আস্তে আস্তে দইতে 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 দেখবা তোমার সাদা যে জলটা দিয়া তুমি দইছো ওই জলটাই বাইর হয়। সো দ্যাট ইজ অলসো ট্রু অফ মেডিটেশন। সো ইট ইজ অলমোস্ট লাইক কাপড় কাচি যেরকম আমরা, so it just brings out the negative emotions first, the thoughts that we are insecure about, and gradually over time and practice, what happens is you have these overflowing of positive emotions. So meditation is a long topic to discuss, and every day throughout the next week we will try some different forms of meditation. Madam, what did you make of the techniques? I know it was not ideal, but how did you find the technique, madam?
It is very good. In fact, I have been practicing it from long time, okay, few years. So when you asked me to do that, though I couldn't concentrate completely, but the way you have given the instruction, that is very good. And as you have already mentioned, that it's a thing of practice. You keep on practicing, you will you can achieve that. Okay, so even I could not close my eyes, and a lot of thoughts were passing by, since I'm expecting my son's result tomorrow maybe. So I'm not mentally, I'm not stable today at least. But then
Yeah,
instruction
yeah.
you have given, and I'm sure if they follow this, they will get benefit.
Yeah, and like Madam said, what happens is when we start to meditate, a lot of negative emotions, a lot of insecurities tend to come in, and those are normal. So you have to understand that those are also my emotions, right? Those are also the products of my brain. So with time, what happens is you appreciate the fact that those negative emotions, and both the positive as well as negative emotions, are actually components of the physical body. So thank you, madam. I really appreciate the fact that you liked it. Moksud, how did you find the technique?
It was great, sir. It was really great. The way you addressed us and the way we proceeded step by step, and it was really grateful. And,
Okay.
meditation is kind of a process. It's not learned or in a flick of a finger, or you can just. It's like not a magic wand. You can just say something, and the meditation will happen of a time. It requires some techniques, some process, one by day step process. And as I say already, always tell you, Rome was not built in a day.
Yeah,
So,
yeah, yeah,
meditation is kind of like our surrounding is chaotic and our brain is also chaotic. Right, it is very much
yeah,
true. Our surrounding is chaotic and our brain is also chaotic. Now, when we sit for
yeah,
meditation, our chaotic minds makes much more noises. We are much more inclined to that noises, and that's what
yeah.
totally disturbs our meditation process. And that's why people try to do meditation such that they detach themselves from this chaotic world, their chaotic mind, and they can at least find this inner peace. And that inner peace is very much well described in that movie called Kung Fu Panda. So how that Master Shifu used to tell that inner peace is the thing you master, not by day, not by year. It's by daily basis you need to master it. That's what meditation teaches us, and it was really helpful how you taught us, sir.
Thank you, Muksud, that you appreciated it. Um, this is the basic technique of meditation, and I know a lot of you will have questions about the different techniques. And like I mentioned, meditation is something that you find in Hinduism, of course, different forms of Hinduism. For there are different sects of Hinduism. They have different types of meditation. We have meditation in the Jain tradition. We have meditation, of course, in the Buddhist tradition. Also, in the Sikh tradition, there is mention of meditation. Interestingly, in Islam, especially in Sufism, there is a lot of mention of meditation, or how you can attain oneness with the Almighty. So, this will be a good topic for all of you to go through. I will come back to Arunodoy once again in a little while, and talk a little bit about how he suggests we can go about meditation. The next thing that we always advise in psychiatry is something known as the relaxation technique. Okay, so this is known as, what I'm going to teach you is known as the Jacobson's progressive relaxation method. Okay, so this is a technique where we relax successive muscle groups. Okay, and it is also a very good method to train your body, because like Sangeeta was mentioning the other day, about, in answer to a question about what happens when you get angry. So what happens when you get angry is your heart rate goes up, your pulse rate goes up, you feel like you are trembling, you feel like there is a dryness of mouth, you feel like your limbs are shaking, you feel like you might be collapsing. So why that happens is because the brain thinks that all your energy needs to be focused, right? So the brain increases the voltage in your brain, and what happens is most of the times what happens is that the most of the time what happens is that you don't get the idea, right? So that is a bit of a problem. So relaxation technique, let us begin. Progressive muscle relaxation. So let us begin with the idea is very simple. Just have to sit relaxed and start focusing your concentration on the different muscle groups. Okay, so let us begin, and by start let us start by focusing on your right arm. Okay, so this right shoulder joint, just focus on your right shoulder joint. Just focus on all, forget about all the other body parts and focus on your right shoulder. Just appreciate your right shoulder, forget about the whole of the body, and just focus on your right shoulder now, this joint. And just as you breathe out, just feel that this muscle groups around this joint are getting relaxed. So let us take a deep breath. My focus is entirely on my right shoulder. As I exhale, I can feel that my right shoulder is getting relaxed. Let us do the same thing on the left shoulder now. So let us take a deep breath. Realize that you are focusing only on your left shoulder joint now. As you exhale, just realize and access and experience how your left shoulder joint is now getting relaxed. Let us try doing this with the right elbow joint. The right elbow joint. Take a deep breath. Focus your energy on the right elbow. As you exhale, just experience how relaxed your right elbow joint is. You can feel the relaxation in the right upper limb. Let us try the left elbow joint now. Take a deep breath. Focus on your left elbow joint. And as you gently exhale, just realize and experience how your left elbow joint is relaxed. Time to focus on your right wrist joint now. Right wrist. This is the body part which you use for all your activities with your hand. So just focus your attention on your right wrist. Lots of small muscles of the hand get attachment in the wrist joint. Just take a deep breath and experience your right wrist. As you exhale, you can feel that there is relaxation of the joint. Let us try doing it with the left wrist now. Take a deep breath. Focus your attention on your left wrist joint. Experience the muscles which are attached to the left wrist joint. And as you exhale gently, feel that there is relaxation in your left wrist joint. Time now to focus on your back. কোমরের দিকে এখন আমরা ফোকাস করব। যে কোমরে ভর দিয়ে আজকে দিন আমরা বই থাকি, আজকে এখন বয়াত আছি, পুরা শরীরের অ্যাটেনশনটারে আমরা কোমরে দেই এখন। Let us focus entirely on the back. Lots of large muscles attached in the back. You have the spinal cord and all the nerves come out. So let us take a few deep breaths and focus entirely on the back. Focus on the muscles around your back. Experience that these are the muscles which contribute in you sitting all day. Take a deep breath. Realize the relaxation around your back. This is the part of the body that takes care of both your legs. As you exhale very gently, feel the relaxation in your back. Time now to focus on our lower limb. Let us do this on our right knee now. The right knee which bears the entire weight of the body. The muscles of the thigh as well as the muscles of the leg get attached at the knee. As you take a few deep breaths, try and focus your entire attention on the right knee joint. You can feel the muscles in your thigh and your lower leg. Now try doing it on the left knee. The left knee also is responsible for weight bearing. Here also you have the muscles of your left thigh and your left leg. Take a couple of deep breaths. Just focus your attention on your left knee joint. As you gradually exhale, just experience the relaxation in your lower knee. Time now to focus on the right ankle. The right ankle is responsible for all the movement that you do all day. Here you have the muscles of the leg and the foot. The small muscles of the foot and the big muscles of the leg all attached at the ankle joint. Take a deep breath and experience the muscles attached in your ankle joint. As you gradually exhale, just experience the relaxation in your right ankle. Time for our last joint of the body, which is the left ankle, also a very major weight bearing joint. Experience the muscles around the left ankle, পায়ের গোড়ালি যেটা আমরা কই, the muscles of the leg and the muscles of the foot get attached to this joint. And as you gradually release, you will feel that there is relaxation in your left ankle joint. You can try doing it for those who have some back pain issues. You can try this technique for your back as well. Some people benefit from this technique. Also, you can try working on your eyes as well. You can try focusing on your facial muscles, and you can carry on this experiment for about 10 to 15 minutes. So this is known as the Jacobson progressive muscle relaxation. I'd like to ask Madam, could you follow the instructions?
It was, the experience was amazing, Himobroto, I must say. I felt so relaxed, and like what I could understand from the whole process of relaxation, ultimately it culminates into a single point: loving yourself,
Yes,
loving
madam,
your
exactly.
own body. Yes, loving
Yes,
your
madam.
own
Yes,
body,
madam.
and just to remind us once again that we are also very precious. That
Yes,
is that
madam. Yes,
feeling
madam.
I have now. It was amazing, amazing. Thank you so much, Himambrata. Thank you so much.
Moksud, could you follow the instructions?
Yes, sir. Yes, sir. It was a very new kind of thing learning today's evening. Thank you for surprising, first of all, and sir, for teaching us such a wonderful technique. Uh,
Exactly.
a small cut in our hand diverts all of our attention to that small cut, and that makes us very much irritating at the some point of time, that when it will get healed, when it will get healed. And this is what was the motto of today's this technique, this like relaxation, how our all the joints and how our body needs relaxation for our mind calmness, how our mind is
Yes.
brain is connected to all parts of our body. If your body is not
Yeah.
stable, if your body is not relaxed, your mind will be disturbed. Because if you are jotting down yourself to doing some work, if your leg is paining, your head is paining, you'll be not able to concentrate to do the particular work, right? So this is what
Yeah.
this relaxation technique is trying to do, like to calm your brain activity. And this is like a new activity kind of learning which you taught, and this was really an amazing journey for this past 10 minutes. Thank you so much.
Thank you so much. Arunodoy, are you with us?
Yes, yes, and
And how was your experience, Arunodoy?
yes, it was pretty much. I do that almost every day. Like you called it some Jacobson technique.
Yeah. Yeah.
Yeah. So I've learned it as what it is known as, like the body scanning technique. Basically, the
Wonderful.
same thing,
Wonderful.
just scanning
Wonderful.
from the top of your head to
Yeah,
your feet.
I would like to request you, Arunodoy, to kindly write down in the comment section, because we are running out of time. So you just write down the do's and don'ts for meditation. There are some practical tips and words of advice for all the participants. I think that will be beneficial.
Okay.
Chirantana, could you perform?
Yes, sir. I have also done that by listening to guided meditation in YouTube.
Okay. I can't hear you properly, but I am thankful that you can hear me. Shoptaporna, could you follow the instructions?
Yes, sir.
And which one was easier? The meditation was easier, or this progressive
This
relaxation?
one. So this one, because I cannot meditate properly,
Yeah,
so it was much
yeah,
easier.
yeah, yeah. Yeah, because here what happens is in progressive muscle relaxation, your brain does not have any uncertainty, right? So the
Yes,
brain is
sir.
now obeying a pattern and obeying a command. So before you start your meditation, what you can do is you can do 5 or 10 minutes of JPMR, and that way your body will be ready for meditation. So
Okay.
that can really help you prepare. Okay. And Chirantana says she has also listened to guided meditation in YouTube, so that's a very good technique. Uh, and Shoptaporna, I'm thankful that you could follow the techniques. I'd like to ask Bisho his thoughts.
So it was really, really wonderful. Means I could feel each muscles. It was so amazing, sir.
Yeah,
Mostly
and
in my
yeah,
ankle, I felt so sensitivity there because I never thought that I could feel my body parts in this way. So it was really amazing, sir, really. So I'm damn
very
sure that
good,
I'm
very
going to
good.
practice this regularly.
Yeah, so what we will do is from now on we will start at 6:50 every day, okay, instead of 7. So we will do one round of JPMR and then start the session. Is that okay with you?
Yes, sir, absolutely.
So,
And
Himabroto,
lastly,
yeah,
madam,
Himabroto, I would like to know অনামিকা দেব's reaction. ম্যাডাম আপনার আপনার কেমন লেগেছে আমাদেরকে যদি একটু শেয়ার করেন আমাদের সাথে।
মাইক্রোফোনটা অন করুন ম্যাডাম একটু। মকসুদ ক্যান ইউ, আসলে আমরা তার মাইক্রোফোনটা অন হয় না, তো ওইটাই হচ্ছে অসুবিধা হয়ে গেছে।
ওহো, আচ্ছা 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 আচ্ছা।
কিন্তু আই এম শিওর শি ইজ হিয়ার উইথ আস, সো
Yes,
জুনিয়র
yes.
ইজ অলসো লিসনিং। আপনারা শুনরানি গো?
Yes, yes.
আচ্ছা আচ্ছা, হ্যালো, ঠিক আছে ঠিক আছে ঠিক আছে ঠিক আছে, থ্যাংক ইউ সো মাচ, থ্যাংক ইউ সো মাচ। হ্যাঁ, আর ঠিক আছে,
শান্তনী।
শুনতে পারবা না? শান্তনী, ও ইউ আর শান্তনী?
Yes, sir.
Shantani,
Yes, ma'am.
Yeah, Shantini. Yeah, go on, Shantini.
how did you
Oh,
feel? How did you feel?
It was quite nice and it was relaxing. Actually, I got to know about this the first time. Earlier, I had the notion that there's only one method of meditation, that is concentrating on the mind or any heavenly, on any spiritual object, etc., etc. So it was. I'm really happy to know this new technique, and I could really feel each and every muscle of mine, and it's quite relaxing. I really like this method.
thank you so much, Shantini, and thank you, Arunodoy, because Arunodoy has written very nicely about Vipassana, and Vipassana is a concept in Buddhism, and it means insight. So the idea is to detach yourself from the thoughts, and it's a very helpful technique. The two types of meditation that we mentioned, the one that we did was the mindfulness technique, where you observe your thoughts passing, and the other form is the Vedantic form of meditation, and that involves awareness. So tomorrow we will talk a little bit about the Vedantic form of meditation, which is a little advanced, but if you do the mindfulness part properly, it should be easy to do the awareness part also. So the idea is in mindfulness, like Arunodoy rightly said, is the idea is to detach yourself from the emotions that arise inside of you. And in the Vedantic method of meditation, what is done is we try and find out a lot more about ourselves. So the awareness component of the meditation is there. Unfortunately, we could not have either of our resource persons. We are really taken aback by the images that have come in from Rongia. It's very bad situation for Shangita. We hope she is safe and we can have her in a subsequent session. Dr. Patil also has been affected by the network issue, and things are not very good in Mumbai. Thankfully, we could meet, and I'm not sure how many of you could hear what I had to say. But before we close, I'd like to have one round of closing comments from all of you, starting with Shantani. Shantani, how did you find this? How did you find today's session?
So it was quite good. I really liked it.
Okay, so tomorrow what we will do is at 6:50 we will assemble and we'll try and relax our body before we start the session. Okay.
Okay, sir.
Okay, and then I'll move over to Bisho. Bisho, your thoughts on the session today?
Sir, today's session was really amazing. Means in a calibrated way, the level is going up. It is rising up, sir, seriously. So I really like the relaxation part. So
Okay,
apart from this, I have a question for you. In the introduction
please.
session, you mentioned about monoclonal antibodies. So
Yeah,
as we all know that it is an RNA virus. So it means it
yeah,
will keep on changing its genomic sequence. So how will the
yeah.
vaccine cope up if it always keeps on changing the genomic
Yeah,
sequence? So
that is exactly the concern, Bisho, because the Russian vaccine that they have claimed, the what has happened is that vaccine has been developed in association with the Russian Defense Ministry. Okay, so
yes.
in the first phase of the trials, they have tested only a handful of of the people from the armed forces. Okay, so
Mhm.
that is not sufficient evidence before you can market it. So the second phase will start on the 15th of July, and on the 15th of July, they will include civilians now. So that will also take quite some time. And in case of vaccines, we are not sure about the decision that Russia will take. But in most of the cases, a phase three is also done, so that you understand how the vaccine works in real life, right? So
Mhm. Yes, sir.
it's okay if it works in the lab, but we also need to be sure that it works in the real life situation. So although it's a very encouraging thing to learn that the vaccine is being prepared by Russia, but it is far away from being ready. So we will have to wait a little longer, unfortunately.
Sure.
Thank you both,
Thank you, sir.
Shantani and Bisho. Arunodoy, thank you for your insights on Vipassana, and it is very good to know that you practice meditation. Your thoughts and comments on this session?
Yes, it was really good, and I really liked your body scanning technique that you taught us. The
Okay,
Jameson
so I
good,
hope all
very
of you will yeah, I hope all of you will practice the mindfulness technique and the progressive muscle relaxation technique tomorrow in the morning. Just try it for 5 minutes each, and let us know when we meet in the evening. So tomorrow we will meet at 6:50, and we will have 10 minutes of muscle relaxation before the session. Okay. And next, let us go on to Moksud. Yeah, Moksud, your final thoughts on this session?
So it was really amazing. The journey, the what you have taught is like something, and as you say, it was lesser secular. You didn't connect to any kind of spiritualism or something like that. You just taught us what is the basic need we need right now to make our mind
And
stable and to,
Moksud, even those who don't believe in God, there are a lot of atheists, right?
yes, obviously, sir.
And there are, I mean, everybody is, it's a free country. We are entitled to our beliefs and thoughts. There are a lot of atheists also who don't believe in the existence of God. But for them also, power, control over the mind is important for them also, right?
Yes,
I'm
yes,
one
very
of
true.
them.
Yeah. So thank you, Moksud, and I really appreciate you joining in and helping us out. Finally, Shotoporna, your comments on the session?
So it was really great. So the JPRT technique is really really new to me, and I'm never focused on the body joints so deeply before. So I'll definitely
Yeah,
try
yeah,
to
yeah.
work on the
And
techniques.
it's also like Madam said, it's also a way to say thank you to your joints,
Yes,
right? The
yes,
joints that take so much the I mean the joints and the body parts that bear our weight. It's good if you find out 10 minutes a day and try and thank all your joints for the weight that they bear, right? Chirantana, our final. Shantani, you have something to
Sir,
say?
Yes,
Yeah,
sir.
say
Sorry
please.
to interrupt. Sir, as we all know that the novel coronavirus, it affects our immune system too. So, most of the we know the symptoms as well. Sir, why is it so that some cases are asymptomatic? Like
Yeah,
our immune
because
system gets activated.
yes, yes. So, like I said, the virus leads to an immune response in the body, right? So, in most of the, in fact, in more than 90% of the cases, what happens is antibodies get developed against the virus. But for people who have comorbidities, who have some other medical issues, for them, what happens is this virus is dangerous and it can travel into the alveolus. So you are right when you say that most of the patients will remain asymptomatic, but for those patients who have pre-existing conditions and who have the triad of symptoms, which is fever, cough with sputum, and also breathlessness, so those will be warning signs for any patient with comorbidity.
Sir, why is it so that some of the cases are asymptomatic? What is the reason behind it?
Yeah, the reason is that not all patients will develop symptoms because the immune response can suppress the virus in most of the patients. But if you are immunocompromised or if you have some pre-existing condition, then the virus can enter into the alveolus and this immune response can become prolonged.
Thank you
Okay.
so much, sir.
Yeah, yeah, yeah. So that brings us to the end of our session. We unfortunately could not have either Dr. Vijayashree or Mrs. Sangita. So I had to do আজকে একটু fill up the gap আমারই করলিতে লাগছে। আশা করি আপনারা সবের কথা তো শোনা যেতে আসিল, একটু টেকনিক্যাল প্রবলেম সবেরই থাকে। I'd like madam to wrap it up and summarize the session for us.
Yes. Thank you, Himobroto. The session was wonderful as you have already got the feedback from all our enthusiastic participants. We get to learn so many things. We get to learn the different aspect of meditation, that is JPMR. Even I am new to that, though I have heard the term, but the technique is really amazing, wonderful. The experience was wonderful. And overall, what you have opened a new door for all of us, a new way to meditate, which was not known to everyone. I think except Arunoday, I don't think any one of us knew that before. So thank you so much. Though we have missed presence of Dr. Sangeeta and Dr. Vijayashree, I hope Vijayashree will join us in the coming days. And thank you to all the participants, and thank you, Maksud, and a big thank you, Himobroto. It was a
Thank
wonderful
you so
evening.
Thank you so much, madam. So, just to quickly summarize the evening for you, we started off by discussing the symptomatology, the pathophysiology of coronavirus. We also spoke a little bit about the different drugs and techniques that are being adopted to tackle the virus. We then spoke about the need for meditation or mind control. We have discussed two techniques today. One is the mindfulness technique, which Arunodoy very beautifully explained is Vipassana or gaining insight into your own thought process. The second part of the talk, I will talk about the Vedantic or the awareness component of meditation tomorrow. We also learned Jacobson's progressive muscle relaxation technique, which is basically a progressive relaxation of the different muscle groups across the different joints in the human body. And I am very glad that all of you have appreciated and could follow both the techniques. A big thank you to our respected faculty members, Shumit Chaudhary sir, Nilotpal joining all the way from New Delhi, and also our little friend who is joining us with Miss Anamika Dev Junior. খুব ভালো লাগছে তুমি যে বইয়ে বইয়ে শুনছো, তোমার মারে আর তোমারে অসংখ্য ধন্যবাদ. A big thank you to Shayantoni, Shotoporna. A big thank you also to Bisho, and Chirantana also joined us. Moksud, as always, great job, and this program would not have been possible without the
Yes.
wonderful without the wonderful insights from Dr. Devi Prita Madam, our program coordinator. So that brings us to the end of the second session of YUVA, this 7-day online session brought to you by Syzygy Mind. Let's meet tomorrow at 6:50, and we will let you know about the resource person and the agenda. And we will begin with 10 minutes of progressive muscle relaxation and start the third session of this 7-day online program. Thank you so much. Good night. God bless.
Thank you, sir.
Thank you, sir. Good night.
Thank you, sir.
Good night. Good night. Thank you. Thank you so much.